Myself, Dr. Shadab. I am Assistant Professor, Department of Radiation Oncology, Jain Medical College. As we all know, cancer is one of the leading cause of death all over, not only in India but also all over the world. Although the variety of cancer they differ, and the care is also very different. Uh, Regarding the care, first of all, I would like to tell here the name, the theme of this 2022 to 2024 Cancer Care Day theme is closing the care gap. So what do we mean by care gap? Care gap is not that what is the standard treatment of cancer or cancer care that should reach each and every patient in equal manner, but that is not feasible. Talking about the Western countries, so they have got the patients which can get the care equally, and the barrier is less there because of many causes. But the care gap mainly comes for the cancer treatment or care in the developing countries, especially like India, or you can say the Asian countries, because there are many factors related to it, mainly the socio-economic factor. I'd like to emphasize this word, socio-economic factor. Social factors. For example, our patients, they mainly belong to the low socio-economic strata. Patients, they don't know about the cancer. They are so poor, they don't know about this disease. They consider it to be some type of cancer, social taboo, and because of one of these many reasons, they do not reach the cancer care facility, or they reach the cancer care facility very late. Regarding the cancer care facility, most of the cancer care at present in India is good cancer care, I mean to say, is concentrated in the corporate hospital or private hospitals. Unfortunately, bulk of the patients, bulk of the population in our country, as they belong to the poor strata, so they don't have access to this cancer treatment or care that is widely available in India. So the main barrier for me, I think the main barrier is the economical issue, because we as a doctor, we know that the patient is coming to us. I am working in a government setup, so most of the patients, they come from a poor strata. Obviously, many of the government setups are overburdened with the cancer patients. We all know the standard treatment, we all know, but actually the standard treatment is quite costly. So in spite we are knowing that we are going to give, we know that what is the standard treatment of this patient, but we are not able to give that treatment because maybe we are lacking the resources because of the financial issues, or maybe if the resources are available, we are not able to give it to the patients because the cost is quite high, and the patient is not able to go to the corporate hospitals where the standard treatment is given very easily. That is mainly for the rich people or those covered under some insurance scheme or like that in Western countries. But in our country, most of the patients, they suffer from this disease, and they suffer from the taboo related to this disease, and they also suffer from the financial issue. They are not able to get the standard treatment, and that is the main problem, that is the main issue in our country. I think this is the main issue. We are not able to give the expected treatment to the patient. What he should receive is not able to receive, and the main reason is the financial issue. We get funds from the government, but the funds are not that much adequate to give the standard treatment to each and every patient. For example, I would like to tell you that in radiation, we have got various types of radiations, and most of these radiations are very costly. very costly, ranging from 1 lakh, 2 lakh, 3 lakh. The poor patient is not able to afford. We are giving radiations. The radiation is good at a very reasonable cost, but we know that we can give a better treatment than this. We don't have that much those facilities at present in our setup, so we are not able to give because of the financial issues maybe there. And even if we are going to have those facilities, we will have to see how much these patients will be able to avail those facilities, because many of the socio-economic factors. So for me, decreasing this gap, the government should think about these things. So how to decrease? Because bulk of our patients, bulk of the Indian patients, they are poor. So government should think that how should decrease this gap, how should make available these treatments easily available at a reasonable cost to the poor patient. Then only we can reduce the care gap. What I mean to say, care gap. We can reduce it only then, and this is the main barrier we have to reduce.
Sir, according to you, what could be the effective or to how we can streamline these patients who are not so much affordable? If any possible solution to this you can advise.
Simply speaking, as I already told, that we need a financial help. We need a financial backup from the government. Now I'm talking about the government setup. We need a financial backup so that we can give those patients the highly costly treatment at the affordable rate, at their own rate. Not going to the treatment of 2 lakh, we should give that treatment in around 10,000, 20,000, 30,000. Then only we will say that yes, this gap has been reduced. Yes, we are able to treat the bulk of the patients. That's the issue.
And sir, one thing which are most of the patients don't recognize or know is why this cancer treatment is so expensive as compared to other problems or other diseases. What is the basic issue that this treatment is so expensive in our country?
Mainly the scarcity of research available at our setup, our country, you can say. I mean, most of the companies, they are doing research mainly in the Western countries, and when they come for the treatment like drugs, their drugs are very costly. The machines for example, for the treatment of radiation, the machines are very costly. So to take over to that cost, and the whole cost goes on to the patient. The patient is not able to afford that. Most of the patients, they are poor, they are illiterate, they are not covered by any insurance scheme, they do not know what is their standard treatment. Even if they know the treatment, they think that this is a disease which is lethal, which is having a poor prognosis, and they don't want to go to a treatment that is very costly because they are having a negative approach. Okay, why should I get treatment for this disease whose final fate is going to be death? So why should I spend so much of money for that? That these are the social taboos related with the patient. And for us, the caregivers, the main issue is the financial issue. So they have their problems, patients, and we have our problems. The main issue is, the link is the socio-economic gap. To us, the government should help the whole of the caregivers in this country so that they can give a reasonable standard treatment to the bulk of the population of this country.
Thank you, sir.
Thank you.